The prostate gland is a walnut-shaped organ that sits right below the bladder, and the urethra runs through it. It's used mainly for reproductive purposes. About 1 in 6 men will be diagnosed with prostate cancer. There are several different risk factors that can make prostate susceptible to cancer. Some of those are African American race, family history, and then smoking has been attributed to it, as well as obesity to some degree. African American men are at about 2.5 to 3 times increased risk over Caucasian or Asian men. There have been multiple studies that have looked at why African American men are at increased risk, and those include different molecular pathways that may put them at increased risk, including with their testosterone receptor may be more sensitive, or may have different pathways that predispose them to that risk. And when I say that, I mean that testosterone is what stimulates prostate cancer, and so there's been some investigation to determine if that may have some role in that. The cancer typically forms in what's called the peripheral zone, the area where we actually do the rectal exam on the back of the prostate. It's very slow growing. It's found at very low grades or at a low aggression level. It usually develops over time into potentially a more aggressive phase. Certainly the majority of patients who are diagnosed with prostate cancer are found at an early stage, and they often have up to 6 months before they need to make a decision, and even longer in many cases, depending on specifically how small or how low grade the cancer is. So they really can take their time and collect information and make an informed decision. People often are scared when you bring up cancer. When we discuss that with patients, we explain to them that the majority of cases of prostate cancer are found at very early stages, and they're very curable. In many cases, it doesn't have to be treated at all if they're older patients, but even in the younger ones, with the different types of treatment that we have, outcomes can be very good and they can be cured of their disease. After men are diagnosed with prostate cancer, we will put them into a risk category, whether it's low, intermediate, or high risk. Men in any of the 3 categories would potentially be candidates for either surgery or radiation. So it may be that that's some combined approach with it where you use both radiation and surgery, but typically in the low and intermediate risk you only use one of those 2 modalities. The risks from any of the treatments are that you have urinary issues or potency issues. Over the past 15 to 20 years, we've learned that with the surgery, that sparing the nerves that run alongside of the prostate will help decrease those side effects. And with radiation, the goal has been to very accurately target the prostate, or to use the seed implants that will minimize the spread of the radiation outside of the prostate, so you don't have that injury to those surrounding structures. UAB is unique in Alabama because you have doctors that focus on just one specialty, whether it's urologic cancers or whether it's prostate cancer or bladder cancer. You get people that are doing a lot of the same thing over and over, and therefore have improved outcomes.